Hello friends, we are going to study today coronary sinus. Coronary sinus is the large vein behind the heart which drains all the deoxygenated blood from heart muscles and carries it to the right atrium. This runs into the AV groove, and as seen in the arrow, you can see this comes as a circular thing just behind the posterior mitral cusp, which joins at the left atrial posterior border along the mitral annulus. So this bright white structure is the mitral annulus. This is the coronary sinus. This is the posterior leaflet of the mitral valve, and this is the left atrial cavity. Let's see how it looks in a dynamic flow. This is the short axis view at the level of mitral annulus or the AV groove. You can see the coronary sinus running transversely into this groove, and this is often seen from in case of very good window. Otherwise it might not be in one plane and you might not be able to see this length of the coronary sinus. Mind you, this coronary sinus, while running transversely, lies behind the left ventricular posterior wall. So this sinus has the importance of CRT, that is synchronizing pacemakers, in which this one lead is inserted in this coronary sinus and pacing can be done here. So there lies the importance of seeing the coronary sinus in a short axis view. Let us examine the coronary sinus in the apical view. It's little bit tricky. From true apical view, you may not be able to see the coronary sinus unless you tilt the transducer towards the posterior wall of the left ventricle. Then you can see beautifully running coronary sinus, and directly it is draining inside the right atrium. This is the drainage area, and this is running transversely, and actually while doing pacing you put the electrode from the right atrium through this hole and go into the posterior part of the left ventricle through the coronary sinus. The electrode should pass through that. There is sometimes a small valve seen at the mouth of right atrium and the coronary sinus, which is known as Thebesian valve. As we talk, that AV groove lodges the coronary sinus. So in true apical view, that standard apical view, you can see at times is circular structure which is coronary sinus, and if the electrode is placed, pacer electrode, CRT electrode is placed, you might visualize that inside this. Here is nothing, so this is actually difficult to say whether this is a coronary sinus, a venous system, or coronary artery. Circumflex coronary artery also may look like this. So you can always look into this. When it is dilated, you will be able to see a big coronary sinus here. Here in this static picture, I'm going to show you how does a dilated coronary sinus look like. This big thing is actually coronary sinus. When you see this big coronary sinus, you have to identify what is the pathology lying here, why it is dilated. I can tell you the most common cause of dilated coronary sinus is persistent left superior vena cava. and how to detect that and what are the implications of dilated coronary sinus will be dealing with in next lecture. So please join and subscribe our channel so that you can get a reminder that you have further channels, further coronary sinus watching can be done. There you go in dynamic picture, the coronary sinus which is dilated. See you till next videos.